Hi guys, good evening and welcome to another episode of Let's Talk Skincare. I always forget to introduce myself. I'm Dr. Trevor Killeen from TK Aesthetics and you're all very welcome to this live Facebook feed. Tonight we're going to be talking about mesotherapy. But before I do that, as I always do, if you haven't been over to check out doing your skin inventory to assess your skin at home, then please do so at tkaesthetics.com and click on the link to skin inventory. Also, please post your questions below and I will get to them at the end of the video. If you're watching this on replay, then please do post your comments and questions and I will answer them as I go along. So as I said, tonight we're going to be talking about mesotherapy. This is a therapy that you may not have heard of, many of you may not have heard of. It's quite a versatile therapy, especially when you combine it with other treatments such as peels and even microneedling to address some of the main skincare concerns that people might have. So, meso means middle in Greek, and in the context of mesotherapy, it refers to the mesoderm in embryology. So that's where our skin comes from as we're growing in the womb. And it's not a terribly new therapy. It's been developed in the late 1950s by Dr. Michael Pasteur. It's not only used for aesthetic treatments, it's been also used in pain management and various other different applications, including the removal of cellulite. And in fact, it was pain management that initially kind of developed things and where things start off from. One of the tenets of the treatment that I quite like is the fact that we use as few drugs as possible at the appropriate frequency in the right place to bring about an effect. And that really is kind of central to the actual treatment by mesotherapy. And actually, I think that's something that I certainly try to adopt when it comes to all of my therapies, that I'm using the right thing in the right place at the right time in the right amount. So that's really, really important. So what is the therapy itself? Okay, so the therapy itself consists of multiple small injections into the skin at different depths depending on what we're trying to achieve. Now it's a very painless treatment because of the depth that we were injecting at, so we're talking about maybe 0.5 millimeter or even less. And a little bit deeper depending on what we might be trying to achieve. But we use a very, very small amount of an injectable and we use a very, very small needle. So it's a relatively comfortable treatment, providing you don't mind needles. And a bit like microneedling, and if you haven't seen that episode, do pop back and have a look at it on Facebook. A bit like microneedling, it causes microtrauma to the skin, and that causes the activation of fibroblasts and then helps in the production of elastin and collagen, and this promotes skin firmness and regeneration. And it's about the delivery of some of these injectable ingredients deep into the dermis and epidermis and allowing them to activate from within. Okay. For me, the big thing about mesotherapy is the injectables, so the solutions that we use to inject, and we can use a variety of different ones, and they can all do various different things, from helping to lighten the skin to promoting regeneration to improving elastin and collagen production to causing tightening of the skin or firming of the skin. And so mixing and matching, we can create quite a few different combinations that enable us to treat lots of different problems and conditions in the skin. So what we're trying to do is we're delivering those solutions into the skin where they can be used by the fibroblasts and take an action rather than just on the skin surface. They're going a little bit deeper. So what are the solutions? So we've got lots of different vitamins that we would use. So vitamin C, which is used for DNA and collagen synthesis. Vitamin A, which is a good antioxidant and again can help to regulate melanocyte activity. And if you remember, they're the ones that produce pigment in the skin. They help with collagen production. Vitamin E is very good for repair and again is a very good antioxidant. The entire range of B vitamins, so thiamine for example, help with energy and DNA and RNA synthesis, which are important cellular components. You've got vitamin B3, folic acid, they all help with energy and cell renewal and cell repair and skin turnover, and they can all help to contribute to the to skin renewal and skin regeneration. Then you have things like amino acids, and amino acids are the building blocks of proteins, and so they're necessary to make sure that our skin improves and helps to reform itself. You've got minerals and coenzymes, which are all used in reactions within the cell and within our skin. And again, having those available to the fibroblasts helps to encourage the production of neuroelastin collagen and neuro-regenerated skin. You also then have things like hyaluronic acid. And I know we've talked about hyaluronic acid lots of times. It's one of my favorite things to talk about, as you probably know from previous broadcasts and episodes. So hyaluronic acid is our skin hydrator, and actually getting it in a little bit deeper into the skin rather than just on the skin surface can help produce that regeneration of the matrix and collagen and elastin, and helps to improve the skin texture and the skin's overall appearance. So what can it be used in the treatment of? So it can be used for skin hydration. So if we're just looking to really improve our skin's hydration, then using a hyaluronic acid solution then is fantastic for this. Lots of signs of aging can be used, so pigmentation, fine lines, wrinkles, skin sagging, improving skin's elasticity, the tone and the firmness. So all of those things can all be helped. It can also be helped with alopecia and hair loss. And there are specific types of alopecia and hair loss that it can help with, but certainly it can help to improve hair production and the thickness of hair, and help to stem the progression of alopecia and hair loss. And on the body then, there's lots of different things that it can be used. Of course, pigmentation doesn't just happen on the face, it happens on the body as well, and so it can be used for that. But also it can be used to help combat different types of cellulite, and that can be quite an important thing for appearance for a lot of people on their bodies. So that's a whole range of things that it can help with. So I'm just going to show you the range that I use is mesoaesthetic. And got some samples here. So if you have a look at this picture here, so you can see here that it has improved hydration as well as improving kind of the skin density. So you've got this firmness has happened in the skin and an improvement of the actual skin's tone, as well as the visibly better hydrated skin after about 5 treatments. And the thing with mesotherapy is that you can have it every 2 weeks for 5 weeks, and then you can have it repeated a couple of times if you feel that you need it. This one shows how it can alter pigmentation. So in the first picture it shows both under a woods lamp and normal light. So the bluish one is under a woods lamp. You can see that the amount of pigmentation across the nose area in particular in this patient, as well as the forehead, has been greatly reduced after about 5 treatments, if that's a particular concern of yours. It also helps, this is using one of the things we use in this treatment is vitamin C, and it helps to improve the skin's general brightness and appearance, which is a secondary effect as well. And the last one that I just want to show you is the kind of lines and wrinkles around the mouth, and an improvement of those over a period of 5 sessions, over about 10 weeks. And clearly, you know, we need to be thinking about, we're not thinking about just about the treatments, we're thinking about our skincare in between, and we can think about combining those with different treatments to give improved effects and improved outcomes from the thing. One of the things I like to combine it with is a peel. So we have a little peel, and then we have the mesotherapy afterwards, and that can help to prepare the skin so that the mesotherapy does a better job when it actually gets into the skin and gets into those layers that it needs to get into. I was going to put another one there, a sample for you to show how it affects the forehead, but again, it can help with lines on and fine lines and wrinkles on the forehead. And again, a particular compound that we use is called DMAE, which is a compound that can be helped to tauten and tighten the skin, and that gives some great effects as well. So if you have any questions, if you want to pop them into the comments now, I will answer them once I finish this roundup a little bit. So next week, we're going to round up the series with a few highlights from the 14 weeks of Let's Talk Skincare. Yeah, can't believe it. Episode 14 already. That's not to say that we won't be back with other things as time goes on, but we certainly will. If you have any questions for next week's episode, if there's something you'd like me to go over again or discuss again in next week's episode, then please do post a comment below, and I'll certainly include it in next week's episode of Let's Talk Skincare. So there haven't been any questions this week, but we look forward to seeing you next week when in the last of this series, but I said there will be more stuff coming. The next thing that I really want to look at is doing a little bit of a series on the skin inventory, and how we can use that to help improve the skincare products that we use and perhaps the treatments that we then go and seek out from skincare professionals. So that's it for episode 14. Look forward to seeing you next week when it's episode 15. And if you have any questions, or if there's anything you'd like me to go over, or there's any topic that I haven't covered for next week, then please do stick it in the comments. Love to hear from you, and look forward to seeing you next week.